Question 1. A nurse prepares to administer IV heparin to a hospitalized client. The MAR wristband and verbal response match, but the client states, "I've never taken this medication before." What is the safest nursing action? A. Administer the medication as prescribed. B. Reassure the client and proceed. C. Stop and clarify the prescription with the provider. D. Ask another nurse to verify the dose. Answer. C. Stop and clarify the prescription with the provider. Rationale. Client concern introduces a potential wrong patient or wrong medication error. High alert medications require clarification before administration. Peer verification does not replace provider confirmation, and proceeding would compromise safety. Question 2. A postoperative client insists on ambulating independently despite dizziness and orthostatic hypotension. Which response best demonstrates patient safety and ethical nursing practice? A. Allow ambulation to respect autonomy. B. Request a restraint order. C. Explain risks and assist with ambulation. D. Document refusal and leave the room. Answer. C. Explain risks and assist with ambulation. Rationale. The nurse must balance autonomy with non-maleficence. Education plus assistance respects autonomy while preventing harm. Restraints and abandonment are inappropriate. Question 3. A nurse receives a verbal order for insulin during a code situation. Which action best promotes patient safety in this high-risk scenario? A. Administer insulin immediately. B. Ask another nurse to confirm the order. C. Perform readback once the client stabilizes. D. Perform immediate readback before administration. Answer. D. Perform immediate readback before administration. Rationale. Even during emergencies, high-alert medications require readback to prevent fatal dosing errors. Delaying or skipping verification increases risk. Question 4. A confused client repeatedly attempts to get out of bed despite fall precautions. Which intervention best aligns with patient safety and least restrictive practice? A. Apply wrist restraints. B. Assign a one-to-one observer. C. Administer a PRN sedative. D. Raise all side rails. Answer. B. Assign a one-to-one observer. Rationale. A sitter provides constant supervision without restricting mobility. Restraints, sedation, and raised rails increase injury risk and violate least restrictive standards. Question 5. A nurse notes subtle restlessness, tachycardia, and decreased oxygen saturation in a client receiving opioids. Which action is the priority for patient safety? A. Apply oxygen via nasal cannula. B. Assess respiratory rate and depth. C. Notify the healthcare provider. D. Prepare naloxone. Answer. B. Assess respiratory rate and depth. Rationale. Early respiratory depression is a life-threatening opioid complication. Focused assessment guides immediate intervention. Oxygen and naloxone may be needed but require assessment first. Question 6. A nurse delegates care to a nursing assistant for a client at high risk for aspiration. Which delegated task poses the greatest safety concern? A. Positioning the client upright for meals. B. Reporting coughing during feeding. C. Feeding the client thin liquids. D. Recording intake and output. Answer. C. Feeding the client thin liquids. Rationale. Aspiration risk. Clients often require thickened liquids and clinical judgment. Feeding thin liquids increases harm risk. Positioning and reporting are appropriate delegated tasks. Question 7. After administering the wrong dose of medication, the nurse finds the client asymptomatic. Which action best reflects priority patient safety principles? A. Complete an incident report. B. Notify the provider immediately. C. Monitor the client closely for effects. D. Document the error in the chart. Answer. C. Monitor the client closely for effects. Rationale. Even if asymptomatic, ongoing assessment protects the client. Reporting and documentation are essential, but occur after patient monitoring. Question 8. A nurse removes PPE after caring for a client on contact precautions. Which action most effectively prevents cross-contamination? A. Disposing PPE inside the room. B. Using gloves during removal. C. Performing hand hygiene immediately after removal. D. Cleaning reusable equipment. Answer: C. Performing hand hygiene immediately after removal. Rationale: hand hygiene breaks the chain of infection and is the most critical step even after correct PPE removal. Question 9. During handoff, a nurse omits critical lab results that later contribute to client deterioration. Which principle of patient safety was compromised? A. Accountability. B. Continuity of care. C. Documentation accuracy. D. Scope of practice. Answer: B. Continuity of care. Rationale: incomplete handoff disrupts continuity and increases adverse events. SBAR exists to prevent this exact safety failure. Question 10. A nurse identifies a cracked oxygen flow meter in a client's room. Which action best demonstrates proactive patient safety leadership? A. Label the equipment as broken. B. Replace the equipment immediately. C. Notify biomedical services. D. Document the hazard in the chart. Answer: B. Replace the equipment immediately. Rationale: immediate removal of faulty equipment eliminates risk. Reporting and documentation follow, but do not replace corrective action. Question 11. A nurse is preparing to administer IV potassium chloride to a client with hypokalemia. Which action is most critical to prevent a sentinel safety event? A. Dilute the medication in IV fluids. B. Infuse the medication using an infusion pump. C. Verify urine output before administration. D. Administer the medication slowly. Answer: B. Infuse the medication using an infusion pump. Rationale: IV potassium is a high-alert medication. Use of an infusion pump prevents accidental bolus administration, which can cause fatal dysrhythmias. Other actions support safety, but do not prevent the most lethal error. Question 12. A nurse finds a client unresponsive with shallow respirations after receiving opioid analgesia. Which action should the nurse take first to ensure patient safety? A. Call the rapid response team. B. Assess airway patency. C. Prepare naloxone. D. Apply oxygen via mask. Answer: B. Assess airway patency. Rationale: airway assessment follows ABCs and determines immediate life threat. Naloxone and oxygen may be needed, but airway compromise must be identified first. Question 13. A nurse notices two clients with similar names assigned to the same room. Which proactive safety action is most effective? A. Use room numbers during identification. B. Place alert signage on the door. C. Verify identity using two identifiers every time. D. Inform the charge nurse at shift change. Answer: C. Verify identity using two identifiers every time. Rationale: two identifiers prevent wrong patient errors regardless of rooming or staffing changes. Signage and reporting help, but do not replace consistent identity verification. Question 14. A nurse overhears a provider giving an unclear verbal order during a noisy emergency situation. Which response best protects patient safety? A. Document the order as heard. B. Ask another nurse for clarification. C. Request the provider to repeat the order clearly. D. Delay the order until written. Answer: C. Request the provider to repeat the order clearly. Rationale: immediate clarification prevents medication and treatment errors. Peer confirmation or delaying care may increase risk during emergencies. Question 15. A nurse is caring for a client with a central venous catheter. Which finding requires immediate action to prevent a serious complication? A. Damp dressing edges. B. Mild insertion site tenderness. C. Sudden onset dyspnea. D. Difficulty flushing the line. Answer. C. Sudden onset dyspnea. Rationale. Sudden dyspnea may indicate air embolism, a life-threatening emergency requiring immediate intervention. Other findings are concerning, but not immediately fatal. Question 16. A nurse delegates ambulation of a postoperative client to unlicensed assistive personnel. Which instruction is essential for patient safety? A. Encourage independence. B. Use a gait belt. C. Walk the client twice daily. D. Document tolerance to activity. Answer. B. Use a gait belt. Rationale. Gait belts reduce fall risk and are a critical safety control during ambulation. Other instructions are appropriate, but secondary to injury prevention. Question 17. A nurse notes a near-miss medication error occurred during the shift. Which action best supports a culture of patient safety? A. Correct the error and move on. B. Report the near-miss per policy. C. Discuss the issue privately with staff. D. Document the event in the medical record. Answer. B. Report the near-miss per policy. Rationale. Reporting near misses allows system improvements and prevents future harm. Near misses are not documented in the medical record, but in safety reporting systems. Question 18. A nurse is caring for a client requiring restraints due to violent behavior. Which action is required to maintain patient safety and legal compliance? A. Reassess circulation every 4 hours. B. Obtain a provider order within the required time frame. C. Keep restraints on continuously. D. Document behavior once per shift. Answer. B. Obtain a provider order within the required time frame. Rationale. Restraints require timely provider authorization and ongoing evaluation. Failure to do so violates legal and safety standards. Question 19. A nurse identifies early signs of sepsis during routine assessment. Which action best reflects effective patient safety prioritization? A. Document findings thoroughly. B. Increase vital sign monitoring. C. Activate the sepsis protocol. D. Notify the charge nurse. Answer. C. Activate the sepsis protocol. Rationale. Early protocol activation reduces mortality. Documentation and notifications are important, but delay life-saving interventions. Question 20. A nurse observes repeated interruptions during medication preparation. Which strategy most effectively reduces medication errors? A. Completing medications more quickly. B. Asking coworkers to assist. C. Using a designated no-interruption zone. D. Preparing medications in advance. Answer. C. Using a designated no-interruption zone. Rationale. No-interruption zones are evidence-based strategies that significantly reduce medication errors. Speed and multitasking increase risk. Case background. A 72-year-old client with pneumonia, dehydration, hypertension, type 2 diabetes, and mild cognitive impairment is hospitalized. The client is receiving IV fluids, IV antibiotics, and oxygen via nasal cannula. Subtle safety threats emerge over time. Question 21. On initial assessment, which finding requires the most immediate safety-focused intervention? A. Capillary refill of 3 seconds. B. Oxygen saturation of 91% with increased work of breathing. C. Blood glucose of 186 milligrams per deciliter. D. Reports fatigue with activity. Answer. B. Oxygen saturation of 91% with increased work of breathing. Rationale. Borderline oxygenation combined with increased work of breathing signals impending respiratory compromise. Safety prioritization follows ABCs. Circulation and glucose issues are secondary at this stage. Question 22. The client becomes increasingly disoriented at night and repeatedly attempts to exit the bed. Which intervention best addresses safety while respecting legal and ethical standards? A. Apply bilateral wrist restraints. B. Implement bed alarm, lower bed, and provide continuous observation. C. Administer PRN sedative medication. D. Raise all four side rails. Answer. B. Implement bed, alarm, lower bed, and provide continuous observation. Rationale. Layered fall prevention strategies with supervision follow least restrictive practice and reduce harm. Restraints, sedation, and raised rails increase injury risk and require strict justification. Question 23. During IV antibiotic infusion, the nurse notes coolness, blanching, and slowed infusion at the site. What is the safest nursing action? A. Decrease the infusion rate. B. Elevate the extremity and reassess. C. Stop the infusion and restart at a new site. D. Flush the IV to check patency. Answer. C. Stop the infusion and restart at a new site. Rationale. Findings indicate IV infiltration. Continuing or flushing the line risks tissue damage. Immediate discontinuation prevents further injury. Question 24. True or false? Acute confusion in hospitalized older adults should be assumed to be baseline dementia unless otherwise documented. A. True. B. False. Answer. B. False. Rationale. New confusion is delirium until proven otherwise and may signal hypoxia, infection, or metabolic imbalance. Assuming baseline cognition delays life-saving interventions. Question 25. Several hours later, the client's blood pressure trends downward and urine output decreases. Which action best reflects proactive patient safety management? A. Continue monitoring trends. B. Initiate fluid resuscitation per protocol. C. Reassess in 1 hour. D. Document findings in the EHR. Answer. B. Initiate fluid resuscitation per protocol. Rationale. Hypotension with decreased urine output suggests poor perfusion. Early intervention prevents progression to shock. Monitoring alone delays treatment. Question 26. After receiving scheduled insulin, the client reports dizziness and tremors. Which nursing judgment most directly protects patient safety? A. Provide oral carbohydrates. B. Obtain a bedside blood glucose reading. C. Assess neurological status. D. Review the insulin order. Answer. B. Obtain a bedside blood glucose reading. Rationale. Symptoms strongly suggest hypoglycemia. Immediate confirmation guides rapid, appropriate treatment and prevents neurological injury. Question 27. True or false? Environmental modifications alone are sufficient to prevent falls in cognitively impaired hospitalized clients? A. True. B. False. Answer. B. False. Rationale. Safety requires multimodal interventions, including supervision, frequent rounding, and clinical assessment. Environmental changes alone are inadequate. Question 28. During medication administration, the nurse notes that two clients share similar names and diagnoses. Which action best prevents a high-risk safety event? A. Ask the client to confirm the medication name. B. Compare the MAR with the room number. C. Use two patient identifiers before administration. D. Administer medications during separate times. Answer. C. Use two patient identifiers before administration. Rationale. Two approved identifiers are the gold standard for preventing wrong patient errors, especially in high-risk situations with similar identifiers. Question 29. The client develops fever, tachypnea, hypotension, and altered mental status. Which nursing action demonstrates the highest level of safety prioritization? A. Notify the provider of assessment changes. B. Activate the facility's sepsis response protocol. C. Increase frequency of vital sign monitoring. D. Obtain ordered laboratory tests. Answer. B. Activate the facility's sepsis response protocol. Rationale. Early sepsis bundle activation reduces mortality. Notifications and labs occur within the protocol, but should not delay activation. Question 30. True or false? Reporting near-miss events improves patient safety even when no harm occurs? A. True. B. False. Answer. A. True. Rationale. Near-miss reporting identifies system vulnerabilities, supports quality improvement, and prevents future adverse events. Ongoing case. The 72-year-old client with pneumonia now shows fluctuating mental status, declining perfusion, escalating oxygen needs, and increasing risk for multi-system deterioration. Question 31. The nurse identifies hypoxia as the primary safety concern. Which assessment findings support this judgment? A. Restlessness and increased respiratory rate. B. Elevated blood glucose and dry mucosa. C. Decreased urine output and hypotension. D. Fever and productive cough. Answer. A. Restlessness and increased respiratory rate. Rationale. Early hypoxia often presents with neurobehavioral changes and tachypnea before oxygen saturation declines further. Other findings suggest dehydration or infection, but are not primary indicators of impaired oxygenation. Question 32. Which nursing actions directly reduce the client's immediate risk for respiratory failure? A. Increase oxygen flow and reposition the client. B. Administer antipyretics and IV fluids. C. Obtain sputum cultures and labs. D. Educate the client on incentive spirometry. Answer. A. Increase oxygen flow and reposition the client. Rationale. These actions directly correct ventilation, perfusion mismatch, and improve oxygenation. Other actions support care, but do not immediately reduce respiratory failure risk. Question 33. The nurse anticipates complications related to worsening sepsis. Which assessment findings indicate progression toward septic shock? A. Warm skin and bounding pulses. B. Hypotension and altered mental status. C. Fever and leukocytosis. D. Hyperglycemia and fatigue. Answer. B. Hypotension and altered mental status. Rationale. These findings indicate impaired perfusion and organ dysfunction, hallmarks of septic shock and immediate safety threats. Question 34. Which nursing interventions are most effective in interrupting the progression of sepsis-related harm? A. Broad-spectrum antibiotics and fluid resuscitation. B. Strict intake and output monitoring and documentation. C. Antipyretics and cooling measures. D. Oxygen therapy and glucose control. Answer. A. Broad-spectrum antibiotics and fluid resuscitation. Rationale. These interventions address the root cause and circulatory collapse, reducing mortality. Other actions are supportive but not definitive. Question 35. The client becomes increasingly lethargic. Which safety risk is now most likely? A. Aspiration. B. Falls. C. Skin breakdown. D. Medication noncompliance. Answer. A. Aspiration. Rationale. Decreased level of consciousness compromises airway protection, making aspiration the most immediate and life-threatening risk. Question 36. Which nursing actions best reduce the identified aspiration risk? A. Elevate head of bed and assess swallowing ability. B. Apply oxygen and suction as needed. C. Place the client in restraints. D. Keep the client NPO indefinitely. Answer. A. Elevate head of bed and assess swallowing ability. Rationale. Positioning and swallowing assessment prevent aspiration proactively while respecting least restrictive care. Question 37. The nurse reviews current safety threats. Which combination represents the highest priority cluster? A. Fever, cough, elevated glucose. B. Hypotension, hypoxia, altered mental status. C. Dehydration, poor intake, fatigue. D. Confusion, fall risk, insomnia. Answer. B. Hypotension, hypoxia, altered mental status. Rationale. This triad signals impending multi-organ failure and demands immediate intervention under ABC and perfusion priorities. Question 38. Which nursing judgment best explains why fall prevention alone is insufficient at this stage? A. Falls are no longer a concern. B. Physiologic instability outweighs environmental risk. C. The client is under continuous observation. D. Bed alarms are ineffective. Answer: B. Physiologic instability outweighs environmental risk. Rationale: while falls remain relevant, life-threatening physiologic threats take precedence in safety prioritization. Question 39. The nurse evaluates outcomes after interventions. Which finding indicates improved patient safety status? A. Stable blood pressure and improved mental clarity. B. Decreased fever and reduced coughing. C. Improved appetite and oral intake. D. Normalized blood glucose levels. Answer: A. Stable blood pressure and improved mental clarity. Rationale: these findings reflect restored perfusion and oxygen delivery, the most critical safety outcomes in this scenario. Question 40. Which system-level action best prevents recurrence of the safety threats identified in this case? A. Individual nurse education. B. Protocol-driven early recognition and response. C. Increased staffing ratios. D. Enhanced documentation standards. Answer: B. Protocol-driven early recognition and response. Rationale: evidence-based protocols, for example sepsis bundles, early warning systems, reduce preventable harm at the system level, aligning with NGN safety principles. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.